Hi, welcome to our webinar today on animal chiropractic as a career, sometimes also called veterinary chiropractic. Today we're going to talk about it as animal chiropractic, but the terms are interchangeable. My name is Nikki Routledge. I have an MSc in animal manipulation chiropractic from the McTimoney College of Chiropractic, as well as a number of other qualifications and affiliations. So what I want to talk about today is what it's like as a career, what's involved. It might be that you are looking for a change in career, that you have plenty of animal experience, but this wasn't really available to you when you were first looking at maybe your career choices, university choices, and so on. Or it could be that you're at school, you're still doing A-levels, or you're at college doing BTECs or similar qualifications, and you're looking for the next step and maybe haven't heard of animal chiropractic. So let's have a think then about what life is like as a McTimoney Animal Chiropractor to begin with. Well, first of all, and a big bonus for me is you tend to be outside the office. Now, there is some paperwork to do, but predominantly you'll be out on the road seeing clients. You might have a clinic if you have lots of dogs to treat, but it's very much more of an outdoorsy job than an indoor job. So if you're the sort of person that likes to be out and about and traveling to different clients, it can be a really good job. You can make good earnings, compared to, for example, working on a yard mucking out, or as maybe a dog walker. There's definite bonuses in terms of remunerance. You will charge a certain fee because that reflects the amount of training that you do need to undertake to become a McTimoney Animal Chiropractor. This is not a quick stop training wise. This is a number of years of training and application, and you will be highly skilled as a professional. If you have your own horses, your own dogs, and you like to compete or you like to go out and do things with them, you can do that. You can arrange your diary the way that you want to. So I like to compete these days in a little bit of dressage with my horse, so I can look up when the local competitions are, and I work my diary around when I want to get out to those competitions. I have quite a few colleagues with dogs that compete as well. They do exactly the same. On the same note, you can take holidays when you want. You're not only able to do the 4 weeks a year that fits around everybody else in the office. You can take the holidays when you want and as you want. And you'll be able to afford them if you've built up a good business. You can fit around family commitments. I have a small person. Most of my colleagues also have small people in their worlds, and they need to be able to pick up from school maybe, or fit around those sort of commitments that come with having small children. And again, you can arrange your diary around that, but still make a good living. It's a fulfilling and a rewarding career. Every day is different. Every time, I go out and see horses or dogs or other species, sometimes it's always that little bit different. What are we seeing today? What's been going on? It's in part detective work. It's talking to the owners, looking at that animal's conformation in terms of the way it stands, but also the way it moves, and putting together a picture of what might be going on and what we can do to help. And it's always rewarding, when your clients come back and say, wow, they've been so different, or they're jumping again, or, that's really sorted them out. You're so much happier, more relaxed, more comfortable. Depends on what the goals are, really. But yeah, when clients come back and say that, you get that little buzz inside, because yes, that's partly what I've done. Now, obviously, there's some things that you need to consider if you're thinking, well, so far that all sounds good to me. You do need to have a certain level of physical fitness. You need to be able to apply adjustments. You need to be able to position yourself around the animals. So there is a need for a certain level of physical fitness. You need to be able to organize yourself. You are unlikely to be in a role where somebody is going to organize your diary for you, tell you what to do, and so on. So there has to be a certain amount of self-motivation about getting back to inquiries, booking clients in, getting to those clients on time. That takes a certain amount of organizational ability. So that's also a requirement, really. For the most part, we work self-employed. So it might be as a sole trader, it might be in a limited company that we've set up, but predominantly you're going to be self-employed. You're unlikely to be employed for somebody, unless you're working within a larger practice. So alongside the fact that you are self-employed, you need to be able to maintain a check on your finances. You need to be able to record your income, your expenses, and to make sure that they're not out of kilter. And you will need good communication skills with your clients. Now, I was always attracted to working with animals because I prefer animals to people. I still probably prefer animals to people, but you need to be able to talk to your owners. You need to be able to elicit the information from them that you need to make an assessment of that case. You need to be able to explain to them what it is you think is going on, what you're going to do, and you need to be able to give them good aftercare, so the directions on what they're going to do next. And that all takes good communication skills. So what is McTimoney Animal Chiropractic, and how does that differ from other forms of neuromusculoskeletal therapy? Well, McTimoney Animal Chiropractic is in fact very light, very quick adjustments on the skeletal frame. We're looking for areas in the spine, the pelvis, and in other areas of the skeletal frame where there's asymmetry. So, for example, we've got a picture on the right here of actually a pelvic adjustment being carried out. The pelvis is a big structure in the horse, and it's part of the engine of the horse. So if the horse is not able to move evenly from both sides of the hindquarters, you're going to feel that when you're riding them and schooling them and jumping them. So what we look for is what height and what distance the tubercocci, the points of hip, are on either side when the horse is stood square. And you might see in the gait that there's some asymmetry in the movement. You might well be able to feel when the horse is stood square that there's asymmetry in the height and the position of those tubercocci. And that tells us that the horse is not able to move evenly. This is the case across all animals and people, in fact. It differs from when you've got a lameness. A lameness is something we would refer back to the vet. So we train to be able to identify lameness so that when that appears, if the owner isn't already aware, we can say, I'm really sorry, but actually you've got a lameness issue there. That needs to be looked at first, because that's commonly a pain issue. However, what we're looking for is this asymmetry of movement. So the horse, if you've got asymmetry, they're not able to perform in the same way. So by giving adjustments or applying adjustments that improve the symmetry, the animal is actually more comfortable again. Similarly, through the spine, you can have areas where the joints are not functioning in their normal range of motion. So maybe they've become a little bit stuck. We've got a lack of movement, or sometimes they actually become hypermobile. So there's too much movement, and that in its own right can set up pain, discomfort, irritability in the muscles around the area, because the muscles are trying to protect that area of the back that isn't working as well as it should, or in a normal way. In the picture on the left here, this dog here, he's having his neck palpated, and dogs commonly get neck issues. For example, they might pull on the lead a lot on their collar, or they play a lot of tuggy, they might play rough with their friends. There's a whole range of reasons, and dogs as well, they do tend to get problems in the lower cervical, that's the neck vertebrae, that can then lead to a lot of pain and discomfort for the dog. And the adjustments that we apply, because they're so light and so gentle, are very readily accepted. The animals relax, they can feel instant improvement. Often people that have been for a McTimoney human chiropractic treatment will report that they feel a massive improvement afterwards. That is in fact how I found McTimoney chiropractic, was through going for a treatment on my own neck after a car crash. And whereas other musculoskeletal therapists hadn't found a problem, my human chiropractor was able to say, wow, you've got a lot going on there, and make a few adjustments. And I felt an instant improvement. It took a few treatments to consolidate. Often people that come to animal chiropractic do because they've seen either their own animals treated or they've had treatment themselves. But yeah, it's absolutely fantastic treatment at improving that symmetry and thereby improving comfort. So that's a little bit of a whistle-stop tour of what animal chiropractic is. But why do animals need treatment? Well, a lot of my clients come to me because they're competing. They're competing their horses, maybe in eventing or endurance or dressage or show jumping. It might be a lot of riding club. My dog clients, quite often it's agility or hoopers. So I see those animals because they are performing at a certain level and we are asking them to perform at that level. That's slightly different to just tacking around the block on your horse or just taking your dog for a 2-mile walk, for example, each day. It's a different kind of challenge. This horse in the picture here is an event horse that we've treated on a number of occasions, and he's typical thoroughbred ex-racehorse who may well be carrying some underlying pathologies from his early racing career as well that also have an effect on how he carries himself, how he copes with the work that's done. So by giving him regular treatments, he's able to loosen up, to move more symmetrically, more evenly, more comfortably again, and carry on performing. So a lot of cases, they will be that sports performance and optimizing health and welfare. We can also have cases which are rehabilitation cases after injury. I've had quite a few dogs with post-cruciate ligaments, so the injuries and surgeries. So they've had the initial rest period, and then what we're doing is looking at how is the body coping now with the gradual reintroduction of exercise, movement, and so on. Now there's other musculoskeletal therapies around that also support that process, but animal chiropractic has a particular role in looking at that symmetry and ensuring that we are able to rehabilitate the body to its best advantage after injury. We can use treatment to optimize breeding performance on post-foaling and whelping. So where we have an issue, I saw a case once with a mare that I was really struggling to get her head down. And the most amazing thing actually about treating an animal that is pregnant is that the body's already in a sort of heightened state, if you like, of repair and improvement or intuitive healing, in that you don't have to do very much treatment in actual fact to get a huge treatment effect. I did very little, a very minimalistic treatment on her, because she was, I think, within a couple of months of foaling, so quite big at this time. And it had a huge effect. I saw her a week later and she was massively improved. She was eating a lot more comfortably. Her whole back shape had changed. She foaled without any issues at all. Post-foaling and whelping, whelping obviously in the case of dogs, well, that could be looking at the maternal side, the mother, the dam, or the bitch, but also could be to do with the foals. One of my colleagues, a previous student at the McTimoney College of Chiropractic, looked at the incidence of asymmetry in foals, and her research was really interesting, but suggested that foals that took longer to get up, foals that took longer to drink, often had pelvic asymmetry, which would imply that part of that birthing process was a little bit more traumatic. And obviously geriatric care. So geriatric horses, again, quite a large percentage of my clients are older animals. They're still in work, and we want them to keep working, because if they're working, they're maintaining muscle strength, they're maintaining their ability to do things. But at the same time, we've got to recognise there probably is underlying arthritic change, and that affects them. So regular care, regular treatment helps keep them comfortable, moving, and happy in their jobs. So what sort of animals do we treat? I've mentioned horses and dogs so far, and yeah, they probably form the greater percentage of the animals that myself and my colleagues see, but you can see a whole range here. One of my colleagues, Helen, here, this is actually a donkey crossed with a pony, so that's a little bit different. A lot of my colleagues and I've seen cats are incredibly flexible. They're actually fairly good at keeping themselves symmetrical, but where they have usually an underlying pathology or condition, or maybe they've been in an accident or injury, that can upset that symmetry, that balance of the system, so they do benefit from treatment. We have a reindeer here. Another colleague of mine, Claire, treats quite a lot of reindeer. So they suffer similar issues that we see in other animals. Obviously we have a dog here, we have alpacas, and we have bulls and sheep and goats, all kinds of animals. I think even one of my colleagues has seen a tapir in a zoo. So even captive species are able to benefit from treatment. Essentially any animal with a spine, the treatment can be applied to. Now, here's a couple of interesting cases that we've seen. On the left here, we've got, this is a racehorse, ex-racehorse, very common for ex-racers to come out very poor foot conformation. There's a very much increased risk of pelvic fracture, whether that's hairline or micro damage to the pelvis when they're in training. There's a lot of these cases with kissing spines, for example. In this particular case, we suspected at some point he'd had a hairline fracture potentially of the pelvis. There was a lot of gluteal, which is the muscle up here, spasm in this in the hindquarters, which indicated that it was protecting that area. As a result, there was a lot of what we call misalignment, but essentially stiffness, where the spine should have aligned into a straight line when he was stood square. It wasn't, it was curved one way, then the other, and then back again. One of the pelvis was dropped on one side, higher on the other, and he also had quite a lot going on in the neck as well. So he was a little bit of a mess. The vet had already seen him. He was happy that he wasn't lame, but his exact words were, but he doesn't move very well. He's not great, but there was nothing obvious for the vet to go forward with diagnostically. He wasn't lame, so he wasn't able to be nerve blocked. So the vet was happy for me to have a look, and we did a treatment. And this is actually the same horse 6 weeks later. Believe it or not, it is just 6 weeks later, and you can see there's a huge difference here. He's put a lot more weight and condition on. His top line looks a lot better, and I think that's probably because he was just so sore. He was so uncomfortable with this pelvic asymmetry, the stiffness through the spine, and this gluteal spasm, that he was, if you like, stressing some of his weight off. With a little bit of treatment, he started to blossom. So this was one of those cases where you can really see a change really very quickly. Not all cases change this quickly. It does depend, it's very individual, but this was certainly one case where we could make quite an improvement. This chap here, he was a 9-year-old pointer, and he had some compression of the discs around C6, C7 in his neck, and it was causing issues with some of the nerve signals that were going out. He had, actually you can't see it in this picture, but wastage of supraspinatus, infraspinatus, some of the shoulder musculature on this left fore. And when I first saw him, he wouldn't put his left front leg to the ground. He was also very weak behind, which is probably due to a little bit of compression on the central nervous system at the neck, which was affecting how his back end was innervated. Although he actually responded to all proprioceptive testing. So that's testing where we're looking at how they move their feet or how they respond to certain positioning of the body, to see whether they know what we're doing and if they can control, their movements, if you like. So neurologically he was fine. He was another one that had been through the vets, and they kind of reached that point of, what do we do next with him? Do we start to do an MRI? Do we and he would present differently on different days. Some days he was a lot worse, some days he was a lot better. So again, vets were happy for me to have a look, and we did a number of treatments on this guy. We didn't treat the immediate area where we know that there was compression, partly because you can't actually get to C6, C7 because they're too deep into the shoulder. But also, even if that had been higher up, we would have worked around. We were looking at what the compensations were, and by improving the way that he's able to compensate, i.e. improving the flexibility, mobility and strength elsewhere through his body, through his neck and body, you're giving that area where you've got the compression the best chance to heal. And within a few weeks he improved. He had a couple of little not quite so good days, but he never went backwards the way he had initially. Within a week he was putting his left fore down. He got a lot stronger behind. In actual fact, I think he was about 9 here. He died at the age of 14 or 15 from a heart condition, so totally unrelated. He did have maintenance treatment through that time, every sort of 3 to 4 months, and quite often that was focused on actually helping his strength behind so that he wasn't overloading the front end again. We see interesting cases like this all the time, and part of our training enables us to understand what could be going on at any one time and how to best help that, whether that's treatment ourselves or whether that's referring back to the vet or referring on to other different paraprofessionals. So how to train, if you're still interested and still watching, there's a number of routes on how to train to become an animal chiropractor. So the first one is the undergrad route. So that's if you don't already have a degree, you've been to school, got GCSEs, A-levels or equivalent, then you would be able to come onto the Master in Veterinary Chiropractic program that begins in 2023. This is a 4-year full-time program. If, on the other hand, you are already postgraduate, so you have already a degree, so you've done school, GCSEs, A-levels, and an animal or equine science, or relevant degree, then you would be able to progress to what we call the Graduate Certificate in Animal Therapy, which is a 6-month program, and from there to the MSc in Animal Manipulation Chiropractic. So this is the route that many of our current graduates have undertaken. If you've not got the animals or equine science degree, but you have a degree in a similar science-based area and a lot of animal experience, then we would invite you to come and have a chat at the college and see whether what you've done meets the criteria. And then finally, route 3 again is a postgraduate route. You've been through school with your GCSEs, you've done A-levels or similar, you have either a human chiropractic, physiotherapy or osteopathy degree, and that allows you direct access to the MSc in Animal Manipulation Chiropractic. So whichever category you fall into, we have a way of enabling you to train. So animal chiropractic is taught by the McTimoney College of Chiropractic, which is located in Abingdon. It was founded in 1972, so over 50 years ago now, by John McTimoney, where the name comes from. And the college has developed over the years. It's at the forefront of animal chiropractic treatment. And in fact, our programs are the only university validated animal chiropractic programs out there. Animal chiropractic treatment, as I say, is very much there in terms of equine and canine, but is increasingly used in the pet and farm industries as well. So we're promoting animal health and welfare across a wide range of industries now. Practical skills are embedded throughout all years of all programs offered, and we think that's very important because it enables you to develop those practical skills. It's not about sitting there at a computer learning stuff by rote. It's all about learning the information and then how do we practically apply that. And that does mean if you're interested in training, you may be required to attend off-site from the college at kennels and stables. Why study with us? Well, for academic excellence, we keep to small class sizes. We have excellent tutor ratios and excellent student support. We're able to do that because of these small class sizes. Every graduate is high quality. You need to come out of the programs managing to meet all what they call day one competencies. So you're able to assess cases correctly. You will have the confidence to go out there and promote your business and promote the confidence of vets that you'll be working with and other paraprofessionals. And as I've said before, we have a route for everyone. For undergraduates, the Master in Veterinary Chiropractic. For postgraduates, the Graduate Certificate in Animal Therapy and the MSc in Animal Manipulation Chiropractic. So to learn more, if you want to train as a McTimoney Animal Chiropractor, you can email admissions at mctimony-college.ac.uk or contact the college on this number. And there's also a college website, so www.mctimony-college.ac.uk. If you want to know more about McTimoney Animal Chiropractic in itself, you can also go to the McTimoney Animal Association website. Now, this is our professional association for all practitioners registered in the UK. We have a website, www.mctimonyanimal.co.uk. We have a list of practitioners in your area. You might want to contact them. We have all our published research on there, so you can have a look and see what sort of things we've been looking into. And we also have a Facebook, Twitter, and Instagram accounts that you can follow us on. Well, I hope that has been of interest. Thank you very much for watching. And if you want to know more, the links are here.